Death certification. Death is the irreversible cessation of all biological function that sustain an organism. Brain death is sometimes used as a legal definition of death. The remains of former organism normally begins to decompose shortly after death. Death is an inevitable universal process that eventually occurs in all living organisms. Types of death: somatic death, systemic death, clinical death. It means complete and irreversible stoppage of vital function. Cellular death or molecular death, it means death of tissues and cells of body individually. Signs of death. Signs of death are strong indication that a warm-blooded animal is longer alive are: first, respiratory arrest, that means no breathing; cardiac arrest, that means no pulse; brain death, that means no neural activity. Stage following the death of corpus or disease. First stage, pallor mortis, paleness which happens in 15 to 20 minutes after death. Algor mortis, the reduction in body temperature following death. This is generally a steady decline until matching the ambient temperature. Rigor mortis, limbs of the corpus become stiff, bracketed Latin rigor, and difficult to move or manipulate. Livor mortis, a settling of blood in the lower dependent portion of the body. Putrefaction, the beginning signs of decomposition. Decomposition, reduction into simpler forms of matter accompanied by a strong, unpleasant odor. Skeletonization, the end of decomposition, where all soft tissues have decomposed, leaving only the skeleton. Last stage, fossilization, natural preservation of the skeletal remains formed over a long period. Cause of death, it can be natural cause, that is natural disease and geriatric causes; unnatural cause, injury, poisoning, drowning, etc. Obscure causes. Manner of death, it is the way by which cause of death was produced. Natural, unnatural. Unnatural means suicidal, homicidal, accidental. Undetermined means unexplained. Practical diagnosis of death: respiratory arrest, no breathing; cardiac arrest, no pulse; brain death, no neural activity; lack of pupillary reflex. Forensic diagnosis: autopsy, exhumation. Celebrities who died of unnatural cause. First diagram, Rajiv Gandhi by human bomb, Indira Gandhi by gunshots, uh, Hitler controversy, suicide or bomb blast, then impersonation and death of another person, Sukumara Kurupa, car accident, Diana, Princess Diana. Celebrity who died of natural cause, example, Atal Bihari Vajpayee, former Prime Minister of India. Celebrity who died of suicide, an example is Robbie Williams, who is considered to be a comedian, but due to depression, he committed suicide. Criteria for diagnosing brain death: patient must be in a deep coma, which is not due to the depressant drugs or metabolic or any endocrine disorder. The patient must not be in hypothermia. Patient must be on a mechanical ventilator or a heart-lung machine. Diagnostic test for brain death, absence of corneal reflex, dilated and fixed people not reacting to light, absence of vestibulo-ocular reflex, absence of cranial nerve response to the pain stimuli, absence of cuff reflex. Death certification. A doctor is the first person who is legally authorized to declare a death and issue a death certificate. To issue a death certificate, condition of certifying death: first, inspection of dead body by the doctor himself, full satisfaction about the death. Doctor must be sure of the cause of the death. Doctor should be free from suspicion of foul play. Doctor has been seen the patient or examined the person within 14 days before death as alive. The doctor registered as a qualified medical practitioner. Can a dentist pronounce a death? No. But there is an incomplete bill in the Parliament 2014 gives a vague legislation that allows dentists to give a death certificate. Informing the local self-government, documental final certificate will be issued by the registrar of the birth and death for the future needs for the deceased. Thank you. അവിടെ വെച്ച് കട്ട് ചെയ്യാമല്ലോ. ഓക്കെ, കുഴപ്പമില്ലല്ലോ. ഒന്ന് നോക്കാം.